My name is Marc Patterson. I'm a child neurologist at Mayo Clinic in Rochester. Today I'd like to talk to you about a common problem in children, which is fainting or syncope. Now, any time a child loses consciousness and falls to the ground, it's a cause of considerable alarm and distress. I'd like to reassure you that in the vast majority of cases, there is not a sinister cause for this. Most children who faint do so because they have what's called vasovagal syncope. It's usually precipitated by something which is frightening to them, by being dehydrated, by standing for a long period of time, or even sitting very still and quietly. And in those cases, all we really need to provide the child and parents with is reassurance. There are, however, some more sinister causes of sudden loss of consciousness that are important to exclude. Now, of course, as a neurologist, I often see children because parents or other physicians are concerned that the child may have had a seizure. And there are a number of clues that can suggest to us that a child's loss of consciousness is due to a seizure. And these are as follows. First of all, seizures are stereotyped. So if a child is having repeated episodes of loss of consciousness, they will follow a similar form. So a child may fall to the ground, have stiffening of the body, jerking or twitching of the limbs, sometimes accompanied by a change in colour, a greyish or purplish discoloration around the lips, for example, sometimes frothing at the mouth, chewing or biting on the tongue. And if the child happens to have a full bladder at the time, he or she may lose control and wet him or herself. Now, of course, some seizures can be more subtle than this. At other times, children will simply become unresponsive and may or may not fall to the ground. But when we're thinking about sudden loss of consciousness, it's those so-called generalized seizures we worry about. There is a particular type of seizure known as a drop attack, where a child may suddenly collapse to the ground, an atonic seizure, or others where a child may stiffen and fall to the ground. Obviously, it's important to diagnose this. The most important aid to diagnosis is an eyewitness description. And so sometimes we don't need the sophisticated equipment we have here to make a diagnosis. We just need to talk to someone who saw the spell, either a parent, or if it's a relative or a teacher, we can pick up the telephone, and often that will give us the key information we need to make a diagnosis. As a matter of fact, the most sinister cause of fainting in children is heart arrhythmias, and particularly a syndrome called the long QT syndrome. We're very fortunate in Mayo at being able to work with a group of experienced pediatric cardiologists, particularly our colleague Dr. Mike Ackerman, who's an international authority on this disorder and in fact has discovered many of the gene mutations responsible for it. Now in this case the story is often a little different. Sometimes the spells can seem like a simple fainting spell, but there may be clues. They're often recurrent. There may be a family history of such recurrent spells, even a family history of sudden death in young adults. Sometimes there's a family history of deafness. Some of these cases are precipitated by an auditory stimulus. For example, a ringing bell or an alarm clock can spark one of these episodes. It is extremely important to make this diagnosis, and in the majority of cases, it's possible to do so with a simple electrocardiogram. So in that case, the diagnosis is crucial, and it may be life-saving with a relatively simple test. We have a very experienced team of colleagues here who are able to manage children and adults who have this problem. In fact, there's a dedicated long QT syndrome research centre and clinic devoted to dealing with this problem. There's another entity that can cause fainting spells in children for which our colleagues in general pediatrics have developed a special expertise. And this is sometimes called POTS, which is an acronym for postural orthostatic tachycardia syndrome. We don't fully understand this entity, but there's a large number of children, particularly in their teenage years, somewhat more girls than boys, who have episodes where they become lightheaded and faint. They may have other problems sometimes with their thinking. They may have other autonomic disturbances such as abdominal pain. Many of these individuals have migraine, which in itself can be a cause of fainting. We have an autonomic laboratory at Mayo Clinic which can perform screening studies to make this diagnosis in children. And we have a team of colleagues who work in our pediatric diagnostic and referral clinic, including a dedicated nurse, who can help families deal with this problem. Again, although its manifestations can be frightening, these children will recover, and they'll do particularly well with some very simple measures, ensuring that they're adequately hydrated, that they have enough salt, and in some cases medications such as beta-blocking drugs may be required to manage the problem safely. So to summarize, fainting or syncope is a loss of consciousness that results from impaired blood flow to the brain. The blood flow may be impaired because of a sudden change in the heart rate or cardiac output, which is mediated through the vagus nerve, so-called vasovagal syncope, the common form that everyone's familiar with, where a sudden fright, the sight of blood, some other upset can provoke fainting. Dehydration, reducing the volume of circulating blood, can be sufficient to provoke fainting if someone is in an upright position for more than a short period of time in some cases. And most importantly of all, a disturbance of heart rhythm, such as the long QT syndrome, must be recognized and treated because that is potentially lethal. Seizures are another form of loss of consciousness that can mimic syncope. Again, the history is usually the most important feature to make the diagnosis, supplemented by special tests such as an electroencephalogram.